So, Eric Gervais, Executive Vice President of Medunik Canada. We just heard your talk. You're talking about some of the myths of the Canadian orphan drug market. Perhaps you could just reiterate what are your top three myths you think that are holding the orphan drug market back in Canada?
Well, the fact that since we do not have an Orphan Drug Act in Canada, a lot of pharmaceutical companies are just discarding Canada as an option. And in reality, in Canada, even though we do not have an Orphan Drug Act, there's some exclusivity that we can have and that we respect for patent, that we respect for new chemical entity. You can have like 8-year data protection. So that's one. The second one is the fact that people believe that there's parallel trade between Canada and the United States, and that's not true. For orphan drugs, it's a non-issue. And if you look for regular drug, it's less than 0.5% of the medication in Canada that goes to the United States, and it's going down. For orphan drug, it's a non-issue. So a lot of CEOs in the United States are using that to convince CEOs in Europe to say, well, you should do a North American deal just to make sure that if the price is cheaper in Canada, the drug will not go back to the United States. But in reality, it's not true. The other point is that Canada, it's a low-price country, and it's a high-price country. The price that you'll get for your patent drug will be similar to Germany, Switzerland, or Sweden. This is a high-price country.
Okay. And you just mentioned there the Orphan Drug Act, which we can talk about perhaps that coming to Canada next year. What impact do you think the Orphan Drug Act will have on orphan drug development in Canada?
I think the big impact, and I believe that we will have this Orphan Drug Act in June 2014. I think the big impact is we will just carve in stone all the regulatory affairs and the cost that goes to it. So you could have like priority review, and the costs will be lower for orphan drugs. Right now in Canada, the cost for an orphan drug and a regular drug is about the same. They start to be open to negotiate depending of the number of patients that you have or depending of the profit that you think you'll have to reduce the cost. But it's not carved in stone. So I think that it'll be better with the Orphan Drug Act. It'll just make it clear for everyone what is the value of it. The downside of our Orphan Drug Act is that I believe we will not have any exclusivity. And I think the exclusivity component is one really important piece for the Orphan Drug Act. So it means that for medication that are repurposed drugs, medication that do not have a patent, maybe some pharmaceutical company will shy away from Canada, and that's a pity because we really need those drugs.
Okay, I see. And the Orphan Drug Act is one change in the future. What other changes do you foresee that might alter the dynamic of the orphan drug market in Canada?
In market access, we have huge problem in Canada, and I see that the private payers right now are pulling together in order to be able to pay for those high-priced drugs. The provincial government are looking into doing the same thing. I think it's going in the right way. I believe that in the future, the problem of market access in Canada will be reduced tremendously. The Canadian government sees that as a problem. As an example, if a province, let's say like Ontario, let's say if they pay for one drug and in Quebec they don't pay for this drug, it means that you can be a Canadian, but depending where you live, you'll have a difference in access to treatment. So people just want to travel from one province to the other one, which create a problem, and sometimes they have like a denied treatment simply because their patient have not paid tax in their province.
Right.
So I believe that in the future all that will be fixed up.
Okay. Okay. Well, thank you very much for talking to me. It's been absolutely fascinating.
Thank you very much. It's my pleasure.
Thank you.
Thank you.